We will now turn to Bill Lawson, who's National President for the Paralyzed Veterans of America.
Good morning, Chairman Murray, Chairman Miller, and members of the Committees on Veterans Affairs. My name is Bill Lawson, proud U.S. Army veteran and National President of the Paralyzed Veterans of America. It is an honor and a privilege to present this testimony highlighting issues of critical importance to the well-being of veterans with spinal cord injury and dysfunction and all veterans across our country. For 65 years, Paralyzed Veterans has represented veterans with catastrophic spinal cord injury and disease, working to ensure that their medical, economic, and social needs are met. I hope to continue that tradition today. The full range of our concern is detailed in my written statement, which has been previously distributed and in this year's independent budget, of which we are proud to have co-authored. In the forefront of many life-changing issues confronting veterans is what we can only regard as an attack on the very existence of VA healthcare system. Without a doubt, the Department of Veterans Affairs is the most effective healthcare provider for veterans. The VA specialized services, including its system of SCI care, are incomparable resources that are not duplicated in the private sector. These services are being threatened by proposed cost-cutting measures, the drive towards so-called management efficiencies, and unfortunately through politics. VA has earned a reputation as a leader in the medical field for its quality of care, cost-effectiveness, and innovation. Even with VA's success as a healthcare provider, some political leaders and policymakers continue to advocate for VA enrollment restrictions, such as the use of vouchers or increases in fee-basis care. These changes will result in moving veterans from veteran-specific care within VA into the private healthcare sector. These proposals would lead to the decline of VA healthcare services and increases in healthcare costs in the federal budget. In fact, these proposals could lead to the destruction of VA, a great American success story. To survive as a quality healthcare provider, VA must maintain a talented, effective, and highly skilled workforce. To ensure that such a workforce exists, VA must update existing human resources policies and procedures. Currently, it takes 6 months or longer to fill critically needed healthcare positions, including filling nursing vacancies. Paralyzed Veterans of America believes that VA must combine competitive compensation packages with hiring incentives such as signing and retention bonuses and educational benefits in an effort to recruit and retain qualified professionals. Paralyzed Veterans of America employs a dedicated team of expert professional medical staff to conduct site visits to all VA spinal cord injury facilities on an annual basis and compiles a monthly survey of available beds and healthcare personnel within VA's spinal cord injury system. These staffing reports consistently reveal deficiencies in staffing, particularly in the field of nursing. Our most recent bed and staffing survey indicates the actual number of nursing personnel delivering care at the bedside was 140 nurses, below the minimum requirements. Likewise, the survey indicates shortages in physicians, social workers, psychologists, therapists throughout the system. More importantly, this means there were 288 unavailable SCI beds throughout the system. Paralyzed Veterans continues to be concerned about the lack of VA's long-term care services for veterans with spinal cord injury or dysfunction. Approximately 6,000 of our members are now over 65 years of age, and another 7,000 are between 55 and 64. These aging veterans are experiencing an increasing need for VA's home and community-based services and VA specialized SCI nursing home care. Unfortunately, the ability of veterans with SCI to access a full range of VA home and community-based care varies across the country, and it's limited. Currently, no SCI specialized long-term care beds exist west of the Mississippi. In fact, the VA only has 150 long-term care specialized SCI beds in the entire system. This averages only 3 SCI long-term care beds per state. Often VA relies upon state nursing homes or contract facilities. Neither of these options is viable for our members due to their inappropriate design and staffing. or their refusal to admit individuals with spinal cord injury or disease. In a recent conversation about long-term care with a VA official, he indicated that the VA needs to look into the future. When you consider the thousands of World War II, Korean, and Vietnam War veterans, their future has already arrived, and the VA has missed the boat. In closing, I understand that some of you are new, and PVA would like to offer our assistance in any way we can to explain what it is PVA does and any other issues you may have concerns about. On behalf of all paralyzed veterans, thank you for this opportunity. We look forward to working with you in providing the services and benefits America's veterans have earned.
Thank you very much.